Okay, well, good morning and welcome to the first of many celebrations of Safety Net Clinic Week this week. My name is Lynn Jones. I'm the Executive Director of the Colorado Association of Family Medicine Residency Programs, for whom most of those operate as Safety Net clinics. So we're proud to be here with our partners, the school-based health clinics and Denver Health and the Colorado Rural Health Center, and looking forward to an active week letting everybody know what's happening. So we do have a proclamation by the governor, and I will read that for us now. Whereas there are a variety of valuable safety net providers in the state, 49 community safety net clinics, 54 federally qualified rural health clinics, 69 rural-based health centers, 10 family medicine residencies, including 4 rural training tracks, and 12 rural rotation sites. Whereas these care settings were established by civic-minded individuals, healthcare professionals and systems, and community organizations who recognize that there are many individuals, children, and families in need of access to healthcare services in rural and underserved areas of Colorado, and whereas people who are uninsured face significant hardships, such as increasing numbers of uninsured people across Colorado, uninsured individuals are 3 times more likely to get sick and not seek needed care. Uninsured individuals are more likely to need hospital emergency care and die from an illness than an insured individual, and 60% of bankruptcies were caused by medical bills before the COVID-19 pandemic. Whereas Colorado's school-based health centers provide primary health care, behavioral health care, and many more services without barriers of transportation, cost, or insurance. Whereas school-based health centers are proven to be powerful tools for achieving health equity and are intentionally established in communities that have been experiencing harm or discrimination. Whereas school-based health centers have demonstrated their ability to increase access to health care, improve academic achievement, reduce emergency room use, lower medical aid costs, and increase the use of sensitive services like behavioral health services. Whereas Colorado's Commission on Family Medicine has for over 40 years addressed documented needs in the state for well-trained family physicians, particularly in rural and underserved areas, as well as the need to prepare family physicians for advanced primary care, characterized by team-based, integrated, and patient-centered care. Whereas Colorado's Commission on Family Medicine promotes high-quality health care for all Coloradans by enhancing access to primary care, including rural and underserved communities, through the training of exceptional family physicians. And whereas Colorado's Commission on Family Medicine cultivates and develops a highly qualified family physician workforce in Colorado to appropriately meet the needs of the population, including rural and underserved communities, through recruitment, education, advocacy, and resource sharing. Whereas Colorado's Commission on Family Medicine requires that all family medicine residents complete a 1-month rotation in a rural location as part of their training. The intent of this experience is to increase a resident's propensity to select a rural site for practice upon graduation. Whereas 47 of Colorado's 64 counties are considered rural or frontier, spanning over 75% of our state's landmass, most of which is considered a health professional shortage area, resulting in significantly less access to care and poorer health outcomes. And whereas rural health clinics provide essential health care treatment and preventive services to vulnerable populations in rural communities throughout our state. And whereas rural health clinics and safety net clinics often lack sufficient funding, workforce, and technical resources, but are creating innovative solutions to delivering patient-centered, high-quality care in an efficient and effective manner. And whereas Colorado Safety Net clinics are safety net providers primarily serving Coloradans who are uninsured, underinsured, or insured through public programs like Medicaid, CHP+, and Medicare. And whereas Colorado Safety Net clinics receive very little, if any, government funding, instead they rely on complex and vulnerable funding streams. And whereas we express our appreciation and gratitude to these clinics and their workers and physicians and care providers who dedicate their time, energy, and resources to serving our communities. Therefore, I, Jared Polis, Governor of the State of Colorado, do hereby proclaim August 22nd through 28th, 2021 as Safety Net Clinic Week in the state of Colorado. Thank you very much.